Today our presentation will be on the types of defensive reactions by Susanna, Ryan, and Alicia. When self is attacked by others, we are often not willing to accept judgment and are faced with cognitive dissonance. Cognitive dissonance is the inconsistency between two conflicting pieces of information, attitudes, or behaviors. The least to say, cognitive dissonance is quite an uncomfortable position to be in, and to eliminate it, we can choose to agree with the critic and accept the judgment and revise yourself. However, most of the times, people aren't willing to accept the accusation because they might not be true or the person is unwilling to admit the accuracy. There are three ways in which the person can disagree, which would be by attacking the critic, distorting critical information, or avoiding dissonant information. Each of these is characterized by a defense mechanism, which are psychological devices that resolve dissonance by maintaining a positive presenting image. Attacking the critic follows the old maxim that the best defense is a good offense. Attacking defensive maneuvers can take several forms, which include verbal aggression and sarcasm. Verbal aggression is to assault the critic directly by saying things like, "Where do you get off calling me sloppy?" which shifts the blame onto the critic without even acknowledging the original judgment as being true. Another way of responding in verbal aggression is to say something like, "You are in no place to complain about my sloppiness." This response resolves the dissonance without ever addressing the issue. Next is a disguising attack in the barbed humor of sarcasm. Sarcasm is often known to score high on wit and quick thinking, but it comes across as hostile and discomforting in nature, usually leading to a counterattack and a mutually destructive spiral. When an individual distorts information, it leaves the representing self intact. This can be done in three ways: by rationalization, compensation, and regression. Rationalization is the invention of logical but untrue explanations of behavior that is unacceptable to the self. For example, a person who says, "I'm not overeating, I have a busy day ahead and I need the energy." Next is compensation, which emphasizes strength in one area to cover up a weakness in another. Regression is when you claim that you cannot do something when in truth you don't want to.
Avoiding dissonant information can be done by protecting a threatened presenting image by avoiding information altogether. There are a few types of defense mechanisms people use. Physical avoidance is to stay clear of people who attack a presenting self in an obvious way to avoid dissonance. Repression is to mentally block out dissonant information by changing the subject, acting as if you don't understand or pretending to not hear. Apathy is to acknowledge unpleasant information but pretend you don't care about it by saying something like, "It was a dumb job anyways." Displacement is to vent aggressive or hostile feelings against people or objects that are seen as less threatening than the person who threatened us originally. In healthcare, there may be times where one uses defensive reactions. Patients may use rationalization by inventing logical but untrue explanations of behavior that is unacceptable to the self. For example, if a person receives a diagnosis that they might not agree with, they might use rationalization to explain the reason for their condition other than the actual diagnosis. A patient may also use displacement in order to vent aggressive or hostile feelings to another person about their conditions. The person that they use might be less threatening, such as a family member, than the doctor or nurse who diagnosed them. For example, the patient might say, "It's your fault that I got a heart attack. You always want to fight, and that is why my blood pressure went so high." Doctors and nurses may also use defensive reactions in their work environment through verbal aggression by saying things like, "Since when do you know better than me about my patient?" This statement not only rejects that the other staff might be true, but it puts down the critic. Regression can also be used by doctors or nurses in a circumstance where they might not want to complete a certain task. They might complain that they cannot do the job when in reality they don't want to do it.
That's not what it means. You have Alzheimer's. It just hasn't progressed enough to get into the trial.
But Derek said I passed. I passed. Meredith, I'm okay. Right?
When I asked you to repeat the 3 words back to me, you said pool instead of spoon.
I asked you to identify my stethoscope. It took you a while to find the word. And I asked you where you took your honeymoon. And you said Hawaii, but you were here because the chief was a medical student and he had to work.
You're just a resident. What do you know? What the hell do any of you know? You work in a hospital all day around sick people and disease? You're obsessed. That's what this is. So I got a few answers wrong. That's all. It's normal to forget things at my age. You can never remember where you parked the car whenever we go to the movies, and they're not saying that you have. It's not fair.
In this clip from Grey's Anatomy, the patient, Mrs. Weber, is using the defensive mechanism of displacement to vent aggressive or hostile feelings because she has just been diagnosed with early-onset Alzheimer's. She blames the symptoms of the disease on old age, and instead of just accepting the diagnosis, she is venting feelings onto the doctors and nurses around her. This concludes our presentation. Have a great day.